I'll be starting with very first thing, that is anatomy, and in anatomy we are going to start with the very first topic, that is upper limb. The main things, main one-liners, main PYTs we are going to cover right here. Okay, now my dear friends, let's start with the today's class. So my dear friends, most common deformities, if we talk about ape thumb deformity, which nerve is responsible? I'll be asking you questions also. You will participate, learn right now and sleep fearless. Be brave and pass this exam. Now my dear friends, next thing is ape thumb deformity. Which nerve is going in the ape thumb deformity? So my dear friends, your answer will be straightforward one-liner, that is your median nerve. One thing. Then partial claw hand. Now your hand like this. This partial claw hand, which nerve is supplying this area? The partial claw hand is because of the previous year question, that is your ulnar nerve, my dear friends. Then coming to the next beautiful question right here, sir. Complete claw hand. When your median nerve and ulnar nerve both are damaged, median and ulnar both are damaged, then your hand will be like this. This is called as complete claw hand. And in complete claw hand, if examiner is going to ask you which two nerves are there, then your answer will be ulnar and the median nerve. So far so good. 3 questions we have covered. One is ape thumb is because of, your answer will be median nerve. Partial claw hand, your answer will be ulnar nerve. Complete claw hand, your answer will be ulnar plus median nerve. Fit in your brain and continue with me. Now coming to the 2 important, another previous year question, tennis elbow and golfer. How we play the tennis, how we play the golf. Golf is coming medially. When we play the golf, to make the shot, we will put our hand medially. So medially if it is coming, what is present medially? It is median epicondylitis. One question, sir. Now tennis elbow, how we'll play tennis? We go laterally, either side pe jayenge laterally. So remember, this tennis elbow is having what, sir? Lateral epicondylitis. Very simple, no need to mug up, just basic understanding, you'll come to know what we are thinking of. Now my dear friends, wrist drop. Whenever there is an injury to the shaft of the radius, which nerve? Humerus. Which nerve is going from here? The radial nerve is going from here, and when the radial nerve is damaged, your hand will be like this. Now can I ask you some extra question from an orthopedic? If there is a wrist drop, which splint we are going to ask our patient to wear? Which splint we are going to ask our patient to wear in such condition, my dear friends? Then coming to the another, after the wrist drop, we are going to go for the foot drop, my dear friends. अब हाथ गिर गया तो पैर गिर गया, जब पैर गिर गया तो उसके लिए जो nerve responsible है, that is your common peroneal nerve. Which splint we are going to wear in case of a wrist drop, my dear friends? Now one is laborer's nerve. Labor क्या करते हैं साहब? मेहनत करते हैं. Labor क्या करते हैं? मेहनत करते हैं. तो remember, laborer's nerve is your median nerve, and musician nerve, mainly musician use this little finger and this finger to play the guitar, etc. So remember, musician nerve is going to be the ulnar nerve. Yes, the cock-up splint is a correct answer. This is how beautifully you are going to correct your answers in your exam. So along with me, repeat everything what we have studied right now. Ape thumb, yes, speak at your respective places, learn along with me. Ape thumb, median nerve. Partial claw hand, ulnar nerve. Complete claw hand, ulnar and medial. Tennis elbow, yes, tennis, lateral epicondyle. Golfer, medial epicondyle. Wrist drop, yes, radial nerve. Foot drop, common peroneal nerve. Labor, मेहनत करता है, median nerve. Musician, ta-na-na-na-na, ulnar nerve. Done and dusted. Comfortable? Arm bones, mainly we have to study about the clavicle, scapula and your humerus. Then coming radius, ulna, and you have to say the carpal bones also. So one by one we'll talk about their important nerve supply, muscle and their clinical importance. Now first bone we have to talk about the humerus. As we talk about the humerus, the surgical neck, if the surgical neck of the humerus is getting fractures, then which nerve is going to get damaged? That is axillary nerve. And axillary nerve is indirectly supplying to the branch of axillary nerve is supplying to the deltoid area. So there will be a regimental batch sensory loss, plus there will be loss of abduction also. Now coming to the shaft of humerus, my dear friend, shaft of humerus, if we see shaft of humerus, there will be a radial nerve, just we have talked about that. Then sir, posterior to the medial epicondyle, this is medial epicondyle, just posterior to this medial epicondyle, which nerve is going, my dear friends? And the name of nerve is ulnar nerve. And the name of nerve is what, sir? Your ulnar nerve. Done and dusted. So 3 important areas of the humerus you have to understand. Exam questions are coming from this area, my dear friends. Coming to the next, hand. Now carpal bones we have to talk about, which is the biggest. First to ossify, last to ossify, all those bone also we have to take care. So my dear friends, number 1, if we say the largest carpal bone, the capital of the country is the largest main state, like Delhi is largest. So C for capital, C for capitate. You have to remember like this, my dear friends. So largest carpal bone is going to be your capitate. Then smallest carpal bone. Then the smallest carpal bone, chota, like we piecing chutney, piecing into small pieces. So remember, this is going to be the pisiform bone. First to ossify, the important capital of country, capitate. Last to ossify, the smallest bone, small, that is going to be your pisiform. Most common bone to get fracture is also orthopedic question, which was asked in the exam, and we are covering right here also. It is your scaphoid, a boat-shaped bone, also the bone which is prone to get the avascular necrosis most commonly. Avascular necrosis most commonly, that is also your scaphoid bone. Can you tell me which cast you are going to give your patient? Which cast? Yes, a question for all the broad-minded medicos and colorful FMGs and all other medicos who are watching us live right now on this YouTube channel, Conceptual Medicine. Please follow us on Telegram also. Conceptual Medicine Telegram channel is also there, where regular your flashcards are there, regular questions are being posted, so that you can learn in most innovative and important way, unique way. And also most common, remember, yes, glass holding cast is a correct answer. So this is glass holding cast. If I'll say this is a glass, I'm holding like this. Okay, so this is glass holding cast, my dear friends. Now, if your lunate bone is dislocated, there will be a compression of a median nerve. Can you tell me which syndrome is going to happen after median nerve compression? Yes, your answer is correct, and that is your carpal bone syndrome. Your answer is correct, and that is your carpal bone syndrome. So again, I want to repeat for all of you what I've just taught you, my dear friends. The largest bone is going to be capitate, smallest pisiform, first to ossify, that is capitate, last to ossify, pisiform. Most common bone to get fracture and go under avascular necrosis, that is also your scaphoid. Most common to dislocate, lead to median nerve injury, lead to carpal tunnel syndrome, that is your lunate dislocation. So far, so good. Let's move on to the next one, that is muscles of rotator cuff, my dear friends. A very famous mnemonic to remember the muscles of rotator cuff, and that is your SITS. And SITS stands for supraspinatus, yes, infraspinatus, teres minor, and subscapularis. So my dear friends, what are the muscles we are having? Supraspinatus, along with me, supraspinatus. This is rotator cuff we are having. Okay, now supraspinatus, infraspinatus, teres minor, and subscapularis are the 4 important muscles. Remember, okay? What is not included? Yes, this question is asked many times. Teres major is not included in this. Teres major is not included in this, my dear friends. Now let's move on to the brachial plexus topic, where we have to discuss about the important root values. So first of all, if we start with the axillary, the axillary is something which is on the top. So top root values you have to remember for the axillary nerve. What are the top root values you have to remember, my dear friends? That is C5 and C6. A unique way to remember this is radial and medial is pura. I have marked it with the yellow. Pura matlab from starting to the end, all root values are involved, and those are C5, C6, C7 and T8, including 8, T1. So radial, medial, pura. Axillary is top value, and ulna bone is the third bone in the upper limb and slightly on the lower side. So lower 3 values, third bone, lower 3 values you have to remember, and that is your C7, C8 and T1. Done, done. C7, C8, T1. This is how the 4 nerve root we have remember. Now long thoracic nerve, long root, C5, C6, C7. Done. Now coming on to the winging of scapula. Now why this winging is happening? A many time question is asked in the exam in the multiple form. Winging of scapula is happening because of the injury to, yes, there is a MCQ, my dear friends. The injury to the long thoracic nerve, my dear friends. What is the root value of long thoracic nerve? C5, C6, C7. C5, C6 and C7, my dear friends. C7, my dear friends. Serratus anterior muscle. This long thoracic nerve is supplying to the serratus anterior muscle, which is getting paralyzed. Because of that, you will see the winging of scapula. Now, other important muscles which are present in the upper limb, we have to focus on for our exam, my dear friends. And those are what? Number one muscle, if we have to talk about, my dear friends, serratus anterior. Again, we have talked about serratus anterior. This is nothing but your boxer's muscle. Boxer's muscle. Boxer's serratus se aage mukka marna hai. Boxer's muscle. Dum, which is a nerve supplying to this long thoracic. What is up function? Pushing and punching. So pushing and punching is done by boxer's muscle. Boxer's is supplied by long thoracic nerve. Done. Khatam ho gaya. Now coming to the latissimus dorsi. Latissimus dorsi is a climber muscle. So who is your climber muscle, my dear friends? Latissimus dorsi. Isko kaun nerve supply kar rahi hai? Thoracodorsal nerve. D for dorsi, D for thoracodorsal nerve. Thoracodorsal nerve. Now pectoralis major, my dear friends. Pectoralis major. The nerve is medial and lateral pectoral nerve. Medial, name itself is telling you medial and lateral. Now what is the action of pectoralis major? Flexion, adduction and medial rotation. Flexion, you can touch your pectoralis right here and you will see flexion में भी help कर रही है, adduction में भी help कर रही है और medially rotation में भी help कर रही है आपकी कौन? Pectoralis major muscle. So flexion, adduction and medial rotation is a function. Now coming to the next muscle called as deltoid. Right here, sir, deltoid muscle is present. So remember, the nerve is axillary nerve. We have talked about the axillary nerve, sir. Now my question is, when your axillary nerve is getting fractured, where the actually fracture is happening on the humerus? Is it the shaft? Is it the neck? Is it the shaft or is it the neck? Please let me know the answers. Neck is a correct answer. Now coming to the deltoid part again. So what is the function of deltoid? It is abduction. Abduction at what degrees? This is also very important. So shoulder joint is getting abducted at different degrees. What are those degrees? We divide them into 3. What are those 3 for the exam? Remember, this is going to come on 17th of January 2026, my dear friends. So 0 to 15 degree, 15 to 90 degree and more than 90 degree. This is how we are going to divide it into 0 to 15. It is going to be the supraspinatus. 15 to 90 it is going to be the deltoid, what we are talking about. Action again, abduction of the shoulder joint. And more than 90 degree, if we have to lift it up, this will be serratus anterior and trapezius. More than 90, if we have to lift it up, it is going to be your serratus anterior and trapezius muscle, my dear friends. Now, if there is an injury to the axillary nerve, so your my dear friends, there will be a deltoid and teres minor getting paralyzed. Loss of abduction is going to be. This is motor function. Now sensory function also asked multiple time in an exam. The regimental batch sensory loss due to the upper lateral cutaneous nerve, which is a branch of this axillary nerve. Upper lateral cutaneous nerve is a branch of, again, upper lateral cutaneous nerve is a branch of, yes, this is a branch of axillary nerve. Axillary nerve, motor function, abduction, sensory is a branch upper lateral cutaneous which is supplying to this area. If this nerve is getting damaged, there is no sensation here. This is called as regimental batch sensory loss. Done and dusted. Done and dusted. So this was all about the deltoid part, abduction part, different angles we have studied. We have talked about the nerve, the branch of the axillary nerve, how axillary nerve is getting damaged, what actions we are losing, what sensory loss we are losing. Now, done. Coming on to the next muscle called as what's your trapezius. Trapezius. The nerve to the trapezius is spinal accessory nerve, my dear friend. Spinal accessory nerve is supplying to the, there are upper, middle and the lower fiber. Upper fiber are elevating, middle fiber are retracting and lower fiber are depressing. तो ऊपर करने का काम किसी का, रिट्रैक्ट करने का काम किसी का, रिट्रैक्ट करने का काम किसी का, नीचे लाने का काम किसी का. 3 फाइबर एक मसल के कौन सप्लाई किया? Spinal accessory nerve. Who is supplying to that? Spinal accessory nerve is supplying to the trapezius, upper, middle and the lower fiber. Now coming to the muscles of anterior compartment of the arm, we are having, my dear friends, remember, yes, shrugging of shoulder will also happen. That if this spinal accessory nerve is gone, there will be a shrugging of shoulder. Now what is shrugging of shoulder? जब कंधे नीचे गिर जाते हैं, कंधे उठ नहीं पाते हैं, this is called as shrugging of shoulder. Done and dusted. So my dear friends, muscle of the anterior compartment is BBC. What is this BBC? BBC stands for biceps brachii, brachialis and coracobrachialis. Again, what BBC stands for? Again, everyone, yes, it is biceps brachii, second brachialis, third is coracobrachialis. Now, who is supplying? The nerve supplying is musculo-cuticular nerve, musculocutaneous nerve. What is their function? Biceps muscle क्या करती है? Flexion of the arm. Very simple. Now, what are the muscle at the posterior compartment? Our favorite muscle, and that is what, sir? Your triceps muscle, supplied by radial nerve. Action is extension of the arm. So, flexion of the arm, biceps muscle, extension of the arm, your triceps muscle. Triceps is supplied by r for radial nerve, and your flexion is done by biceps, and biceps doing the flexion part. Done. Comfortable? Okay, done. Now, my dear friends, 𝗶𝗵 palsy and 𝗏𝗵 palsy. So, 𝗶𝗵 palsy, if we see, C5, C6 roots are involved, my dear friends. 𝗶𝗵 palsy, C5, C6 roots are involved. That means upper roots are involved. Upper roots were mainly for the axillary part. Okay, sir? Now, here you will see a policeman tip deformity, or you can say waiter's tip deformity. How this deformity is? There will be adduction. That means your hand will be like this, medially rotated and pronated like this. This is called as your policeman tip deformity, because Arab countries, policemen cannot take money like this. ऐसे दे दो. So they do their hand like this. So this is your mnemonic to remember. Nothing personal about any country. Done. Chalo, let's talk about the 𝗶𝗵 palsy. 𝗶𝗵 palsy is done. Now remember the 𝗏𝗵 palsy. So two palsies, one question is for sure coming in your upcoming exam, my dear friends. Coming with this, sir. 𝗏𝗏 palsy is lower roots are involved, and lowermost two roots are C8, T1. So in the 𝗶𝗏 palsy, upper two roots were involved, C5, C6. Here the lower roots are involved, and what are those? C8, T1 roots are involved. Now full claw hand is seen. Can you tell me which two nerves are involved in the full claw hand? I taught you in the beginning, and you all have to answer. Will it help in NEET? For sure it is going to help you in the NEET also. Can you answer? Ulnar and medial. It is ulnar and medial nerve. So the full claw hand plus Horner syndrome is seen. And very famous mnemonic to remember the Horner syndrome is P-male. Female nahi, P-male. Okay, P-male. ठीक है, चलो. P stands for ptosis, dropping of eyelid. Meiosis, shortening pupil. Then anhidrosis. Anhidrosis means loss of sweat. Then loss of ciliospinary reflexes loss, and eye is going inside, that is anophthalmos. That is called as what, sir? Anophthalmos. So मेरे साथ में Horner syndrome का mnemonic याद करेंगे. Yes, Horner syndrome is ptosis, meiosis, anhidrosis, loss of ciliospinary reflex, and anophthalmos. So these are the important mnemonic. P-male associated with 𝗏𝗏 palsy, full claw hand associated with again 𝗏𝗏 palsy. Now coming on to the next one, sir. Dermatomes of the upper limb, very important. So if we have played in the bachpan time, early childhood, we have played maybe cricket with the hands, and you all remember this is 6 and this is 6. This is something when we have to go for the emergency and we ask to wait. Wait is sounding like a 8. So this is 8. This is 6. So what is left? These 3. So these 3 are middle 3 finger, that is C7. So thumb is 6. These 3 are 7, and this is weight, that is your 8. Weight and 8. Done. Now, my dear friends, anatomical snuff box. Important question for your exam. Going to come in your exam. Now, anatomical snuff border, what are the lateral boundary, medial boundary, floor, content, roof? Every question is important. One topic, 4 to 5 questions. If you know, you are good to go to the exam. So let's work more hard together to ace this topic together right now. So my dear ladies and gentlemen, buckle up yourself to learn this topic. So here if you put this hand in the anatomical position, so you will see the thumb part is going to be the lateral part. So here you will see the thumb part. The thumb part is having two important structure, that is your extensor pollicis brevis and your abductor pollicis longus. Now what is left? Medial part, which is towards the finger. So these are the fingers. We are having medial part. So one boundary is there, that is extensor pollicis longus. So extensor pollicis brevis along with the abductor pollicis longus, they are part of the lateral boundary, and only extensor pollicis longus is a part of the medial boundary. Okay? Chalo, done. Now posterior medial boundary we have done. Now floor is formed by ST. The floor is formed by ST, that is scaphoid and trapezium. Very simple, sir. Lateral, two boundaries. What are two boundaries? Please write meanwhile in the chat box. Then coming to the floor, ST, scaphoid and trapezium. Now roof is formed by cephalic vein and superficial branch of the radial nerve. So one vein called as cephalic vein, superficial branch of the radial nerve, they are forming the roof. Floor by the ST. Boundaries we have talked. What is content? Very simple answer, and that is your radial artery. So we talk about the lateral boundary, we talk about the medial boundary, we talked about the floor, roof, content, done. So everyone comfortable? Let's talk about supination and pronation. What is supination? What is pronation? So my dear ladies and gentlemen, buckle up yourself. This is supine position, this is pronation. Where it is happening? This is happening at this joint. What this joint is? This is nothing but your radio-ulnar joint. Nothing but your radio-ulnar joint, sir. Now dorsal interossei and palmar. Dorsal interossei or palmar. D for dorsal, D for dur. P for palmar, P for pass. Okay? Dur and pass, like this you remember. So दूर लेके जा रहा है मतलब फिंगर को abduct कर रहा है. फिंगर को abduct करने का काम dorsal interossei करता है. फिंगर को पास लाने का काम, that is adduction of the finger, that is done by palmar interossei. That is palmar interossei. Palmar interossei. Lower border of the scapula, again a debatable question, but most probably the answer is going to be the 7. C7. Yes, card test we do for checking the adduction of the finger. Adduction of the finger. Now, coming to the lower limb now. We successfully completed our upper limb. Are you comfortable? Are you satisfied? Happy, my dear friend? Because your happiness matters right here. Once you are happy, you are confident, you are revising, you are passing. Yes. And you are passing. On 17th of January 2026, you all are going to pass with the flying colors. Yes, my dear friends. Let's move on to the next one. Chaliye, let's talk about the thigh. Now, lower limb thigh we'll talk about. We are dividing this thigh into anterior compartment, posterior compartment, and medial compartment, my dear friend. Okay? Anterior compartment, posterior compartment, and medial compartment. My dear ladies and gentlemen, this you will see your anterior compartment root values and medial compartment root values are same. So what is difference? The difference is origin of the nerve from the ventral rami. If this is ventral rami and the nerve is coming from posterior side, this is called as femoral nerve supplying to the anterior compartment. And this is ventral rami and the nerve is coming from anterior side supplying to the medial compartment of thigh. This is called as obturator nerve. So femoral nerve and obturator nerve root values are same, L2, L3, L4. One is coming from posterior side supplying to the anterior compartment of the thigh. One is coming from the anterior side and supplying to the medial component of the thigh. Remember, now posterior compartment is supplied by sciatic nerve and the root values are L4, S3. L4 and S3. Done. Now muscles of the anterior compartment of the thigh, you can very well remember the quadriceps group of muscle along with tensor fascia lata and serratorius. These are the anterior compartment group muscles, and these muscles are supplied by which nerve? We have just talked about. Please correct. Okay. Now, the muscles of the posterior compartment of the thigh. Posterior compartment of the thigh, you will see adductor. So, name is very common for the posterior compartment. Very good. This is adductor. One is longus, one is brevis, one is magnus. Along with that, pectineus and gracilis muscle is there. Adductor. That is longus, brevis and magnus, and along with that pectineus and G for gracilis. Now sir, this is medial compartment, anterior compartment and posterior compartment which is supplied by the sciatic nerve. Sir, biceps femoris long head, biceps femoris short head. Biceps femoris long head, biceps femoris short head, done. Semitendinous and semimembranous, khatam, done. So these are the compartment of the thigh and the muscle and the nerve supply. Now let's talk about the femoral triangle. Femoral triangle, we are starting from the structure from the medial side to the lateral side, my dear friends. And medial side to the lateral side, it will be APPI, up P. The mnemonic is APPI. A stands for adductor longus, pectineus, psoas major and iliacus. This was question once asked in the exam. Upper mnemonic, just remember, for the femoral triangle starting from medial side going to the lateral side. Okay, lateral side. Just remember names as of now for the revision part. Okay, external iliac artery. Now the course we are going to talk about the popliteal artery, which is an artery which is most difficult to feel. Now this external iliac artery is passing from where? This external iliac artery is passing through the deep inguinal ligament. Now the name is changing. Once it is passing through the structure, new name is coming. So external iliac artery is passing through the deep inguinal ligament, the new name is femoral artery. Now this femoral artery is passing through the adductor hiatus, the new name is popliteal artery. The new name is what, sir? Your popliteal artery, popliteal artery. So popliteal artery is the most difficult artery to feel at the popliteal fossa. Now coming to the femoral sheath, starting from medial to the lateral side, what important structures you have to remember for the exam? This is again exam question you have to pay attention to, my dear friends. Now laterally what is present, one is artery and one is nerve. Laterally if you will see, this is femoral artery and genitofemoral nerve you are going to see. In the center we are having femoral vein, very simple. Lateral artery present है, बीच में vein present है. अब medially क्या present होगा? Medially present होगा आपका lymph node of Cloquet और Rosenmuller. Lymph node of Cloquet और Rosenmuller. आर्टरी नर्व ने एक साथ दोस्ती कर ली. लेटरल में बीचों बीच जो इंटरमीडिएट कंपार्टमेंट था वहां फिमोरल वेन आती है. And the medial most part which we are having, it is having a lymph node of Cloquet or Rosenmuller. Done and dusted, my dear friends. Now the examiner's favorite region, gluteal region. Yes, he asked about the muscle and the nerve supply. Bigger muscle, inner nerve supply. Smaller muscle, outer nerve supply. This remember, and this is how we are going to apply to learn all this thing. My dear friends, gluteal region, we are having a muscle called as gluteus maximus. This gluteus maximus nerve supply is नीचे वाली nerve, inferior gluteal nerve. What is the function of gluteal nerve? What is the function of gluteal nerve? Extensor of the hip joint, helps in sitting and standing. Gluteus maximum, sitting, standing. Sit up, sit up, sit up, supplied by inferior gluteal nerve. Now gluteus minimus and maximus, my dear friends. Gluteus minimus and maximus, the nerve supplied is superior gluteal nerve. Minimus and maximus को medius को superior gluteal nerve supply कर रही है, and these are the chief abductor of the hip joint. Now injury to the superior gluteal nerve, if it is happening, the person will be watching with a lurching gait. Lurching gait ऐसे लंगड़ा के चलता है आदमी, abduct नहीं कर पाता, घिसट के चलता है. So remember now, 2 one-liners you have to remember. Okay. Remember, dorsiflexion and plantar flexion occurs at which joint? It occurs at the ankle joint. What is dorsiflexion? What is plantar flexion? This I am doing. This is plantar. This is dorsi. This is plantar. This is dorsiflexion. We have to remember. Now, eversion and inversion. This is eversion of the foot. This is inversion of the foot. ठीक है? In ऐसे नहीं होता. In ऐसे होता है बाहर की तरफ को. ठीक है? They are occurring where? At the subtalar joint. These also 2 one-liners you have to remember for the exam. Yes, Trendelenburg sign you are going to get in such case. Okay. Now let's study about the root of the sciatic nerve, because this is again a previous year topic for your exam. The sciatic nerve, if you have to remember, my dear friend, sciatic nerve number 1 is tibial nerve and next is common peroneal nerve. 2 nerve it is giving. The sciatic nerve is giving branch to tibial nerve. And this tibial nerve is supplying to which compartment? 3 compartments we are dividing. One is anterior compartment, one is your lateral compartment, and one is your posterior compartment. Now, remember, this tibial nerve is supplying to the posterior compartment of the leg. Now, this common peroneal nerve, which was responsible for the foot drop, this is binding around the neck of fibula. This is also a question. So which nerve, if there is a neck of fibula fracture, which nerve is going to get damaged? Your answer is common peroneal nerve. This was asked in your exam कि अगर आपके फिबुला पे फ्रैक्चर होता है कौन सी नर्व जाती है? कॉमन फेमोरियल नर्व. और कॉमन पेरोनियल नर्व की वजह से किस चीज का फ्रैक्चर होता है आगे जाके? क्या चीज होती है आगे जाके? दैट इज योर फुट ड्रॉप. Now this common peroneal nerve is giving supply to the 2 things. One is deep peroneal, another is superficial peroneal nerve. Now, sir, this deep peroneal nerve, remember, it is a nerve of an anterior compartment of a leg, and superficial is a nerve of a lateral compartment. The posterior compartment, tibial nerve, anterior compartment, deep peroneal nerve, and superficial peroneal nerve is supplying to the lateral compartment of the leg. And who is supplying the first web space? It is supplied by the deep peroneal nerve, my dear friends. Now we talk about the thorax. True ribs, false ribs, floating rib. Very simple. 1 to 7 true ribs, 8 to 12 false rib, and 11 to 12 will be the floating. Sternum angle. The angle between manubrium and the body of the sternum, it is present at lower border of T4, my dear friends. Angle between the manubrium and the body of the sternum, this is called as sternum angle, once asked in the exam, my dear friends. Now, important question is, if you have to do a thoracosynthesis or needle thoracotomy, so remember how you will plan it. Is it the lower border? Is it the upper border? Always go with the upper border, never go with the lower border. Why? Because in the lower border, what is present? Neurovascular bundle. This is vein, artery, and nerve. Very important previous year question which was asked in the exam, my dear friends. Now coming to the borders of the heart and the blood supply. So remember, all the veins of the hearts are supplying first to the coronary sinus. They are draining first to the coronary sinus. From coronary sinus, they are going to the right atria, except anterior cardiac vein, it directly is going to the right atria. पहले सारी जितनी है वेन वो coronary sinus के पास जाती है, वहां से आगे जाती है, but except cardiac vein, anterior cardiac vein, it is directly going to the atria. Now, who is making the inferior surface, base, and the apex? The inferior surface of the heart is made by both the ventricle. The base is made by both the atria. Inferior surface and the base, ventricle, atria. Apex is made by Apex is made by left ventricle, my dear friends. The apex is made by left ventricle. Now let's talk about this trachea. What is the length of trachea, my dear friend? 10 to 12 centimeter from lower border of cricoid cartilage, that is C6 to T6. Okay. Now important topic is esophagus. Esophagus, my dear friends, 25 centimeter length. The lower border is C6 to C11. Narrowest point is at cricopharyngeal junction. Chalo, let's talk about the diaphragm right now, sir. Diaphragm. So we'll see a diaphragm right here. 3 opening of their voice of America we see. Opening number 1 is vena cava opening present at level T8 and the structure passing through this inferior vena cava and right phrenic nerve. Very important thing to remember for the exam. Inferior vena cava and right phrenic nerve is passing through here. Now esophageal opening is present at T10. So the structure present right here passing through right here is OVL, that is esophagus, vagal trunk, and left gastric artery. Esophagus, vagal trunk, and left gastric artery. Now coming to the aortic opening, my dear friends. Aortic opening is present at T12. So remember 2 gap is coming, T8, T10, T12. So here we are having a mnemonic A for ATA, aorta, thoracic duct, and azygous vein. Now I'll ask you question and you will give me answer. Sir, thoracic duct is passing through. My next question, vagal trunk is passing through. Esophagus, right phrenic nerve is passing through. My next question, right phrenic nerve is passing through. Now these are the name of the cranial nerve, just to give you an orientation. Nerve number 1 is olfactory, 2 is optic, 3 is oculomotor, and 4 is trochlear nerve. 5th nerve is trigeminal nerve, having the 3 branches. How to remember? Mom mnemonic, maxillary, ophthalmic, and mandibular. 6th is abduction nerve. 7th is very important, facial. 8th is what we have studied yesterday in the ENT session, that is auditory nerve. 9th nerve is glossopharyngeal. 10th is vagus, accessory nerve, and hypoglossal nerve. So these are just the names of different nerves you have to keep in mind for your exam. Okay? Just go through it and remember the main nerve, 7th nerve, 8th nerve, vagus nerve, trigeminal nerve. First nerve is olfactory, second is 2 eyes are there, so optic nerve is there, sir. Now coming to the important foramens of the skull. So just remember these foramens and once try to go through the image to mark them where they are. Cribriform plate, which nerve is going from here? It is cranial nerve number 1. What is cranial nerve number 1? That is your olfactory nerve. Optic canal से कौन सी nerve जा रही है? Optic nerve plus ophthalmic artery. Foramen rotundum, we are having maxillary nerve. Foramen ovale, we are having male. What is male? Foramen ovale, it is your male. Male stands for mandibular nerve, accessory nerve, lesser petrosal nerve, and emissary vein. Mandibular, accessory nerve, lesser petrosal nerve, and emissary vein. So these are the important foramens with the important structures you have to remember for the exam. Now nerve supply of the face. Sensory supply is, full face is supplied by the trigeminal nerve, except the skin over the mandible. It is supplied by great auricular nerve, which is also called as nerve of foreplay. Why it is called as nerve of foreplay? It is present on the ear, sensory supply to the ear, and once you touch the ear, I don't have to explain you what happens. Okay, chalo. So remember, sensory supply of the face. Again, I want to repeat. The full face is supplied by trigeminal nerve, except skin over the angle of mandible, which is supplied by great auricular. Now the motor supply, जिसकी वजह से तुम ई, ऊ, आ करते हो. So remember this motor supply of the face. मतलब you are making the different type of faces. The motor supply of the face, full face is supplied by the facial nerve, except the muscle of mastication. जो चबाने के muscle होते हैं, the muscle of mastication is supplied by the mandibular nerve. So mandibular. So sensory supply done, motor supply done. Now what are the muscle of mastication? The muscles of mastication is masseter, temporalis, medial pterygoid, lateral pterygoid. Masseter, temporalis, medial pterygoid and lateral pterygoid. It is supplied by the mandibular nerve, sir. It is supplied by the mandibular nerve, sir. Mandibular nerve. Now depression and opening of the mouth is done by what, sir? Your this muscles of mastication, and mostly in this you will have a lateral pterygoid, medial pterygoid participating. Okay, chalo. Common carotid artery is giving branches to external and internal carotid artery. Let's see the branches of the external carotid artery. This external carotid artery is giving branch called as 𝗲𝗵𝗵𝗺. 𝗲𝗵𝗵𝗺. Superior thyroid artery. You can very well see with the help of diagram also, sir. External carotid artery ka. If it is supplying near the thyroid, this is going to be the superior thyroid artery. If it is going to the lingual surface, that is lingual artery. Going posteriorly, pharyngeal wall, remember this is ascending pharyngeal artery. Coming to the face, facial artery. Coming to the maxillary area, maxillary artery. Going posterior to the ear, posterior auricular artery. Going to the occipital region, occipital artery. Going to the temporal region, superior temporal artery. So how simple it was to remember all those things, my dear friends. Now facial artery. This facial artery, the fourth number what we have talked about, giving to the SIT, that is superior labial, inferior labial and tonsil artery. Okay? Now maxillary artery will give MSG, that is messenger of God. Okay? So remember, middle meningeal artery, sphenopalatine artery and greater palatine artery. So these are the branches you just have to go over through before your exam, my dear ladies and gentlemen. Coming to the salivary gland, we are having parotid gland, drained by stensons or parotid duct. Where it is opening? Opening near the second molar tooth. And during the parotid surgery, we might can end up with a syndrome called as Fraze syndrome. What is this Fraze syndrome? In Fraze syndrome, there will be a damage to a MCQ nerve, that is auriculotemporal nerve, which is branch of mandibular. So mandibular nerve ka is a branch is auriculotemporal nerve. Once we are operating the case of parotid, there are chances this auriculotemporal nerve is getting damaged, because of which the patient will be complaining, whenever I am chewing, Dr. Saab, whenever I am chewing, there is increase in temperature plus sweating is happening on that side, my dear friends. That side, my dear friends. So sign and symptoms are redness, flushing, sweating, increased temperature on the lateral border of the teeth, just gustatory swelling. Gustatory swelling you will see in the Fraze syndrome, and then the Fraze syndrome, which nerve we were talking about, auriculotemporal nerve, branch of mandibular nerve. बस 17 तारीख तक याद रखो, भला हो जाएगा. Some mandibular gland drained by Wharton's duct, where it is opening, floor of the mouth. Done. Carotid sheath, important, my dear friends. So this is a cut section of a carotid sheath. One artery, one vein and nerve is extremely important to remember right here. So which vein we are talking about in the carotid sheath? Internal jugular. Which artery? Common carotid artery. Which nerve? Vagus nerve. So here you will see the cut section where anterior part mein 𝗪𝗃 cervicalis is present, posterior part mein sympathetic trunk is present. Now 𝗪𝗃 cervicalis is supplying to SOS, sternothyroid, omohyoid and sternothyroid. That is sternohyoid, omohyoid and sternothyroid. Sternohyoid, omohyoid, sternothyroid. This is exam question, was asked in the exam previously. Now let's talk about another topic called as tongue. Who is motor supplying to the tongue? So all muscles of the tongue, all muscles of the tongue are supplied by hypoglossal nerve, my dear friends, except the palatoglossus, which is a safety muscle of the tongue, which is not the safety muscle is genioglossus. So remember, all muscle, motor supply I am going to talk about, sir. All the muscle of the tongue are supplied by hypoglossal nerve except palatoglossus, which is supplied by vago-accessory complex, nerve complex of 10th and 11th nerve. Sensory supply. Let's see, anterior 2/3 general sensation is by lingual nerve, taste sensation is by chorda tympani. Yesterday also we have talked in the ENT class about the chorda tympani, which is a lingual branch of facial nerve only. So remember, general sensation is by lingual nerve, taste is by chorda. Posterior 1/3 if we talk about, anterior 1/3, posterior 2/3 we talk about, general sensation and taste is by glossopharyngeal nerve. Posterior most is by vagus nerve. Safety muscle genioglossus. If hypoglossal nerve ka injury is there, tongue will protrude to the same side of the lesion. Same side of the lesion. Little's area we have talked about yesterday, anterior inferior quadrant, and the nerve supply to this is gas, that is greater palatine, anterior ethmoid, sphenopalatine, and superior. Out of these four, which is the artery of epistaxis? Which is the artery of epistaxis? And then we are going to talk about the next topic, that is cranial nerve. Who is pure sensory, who is pure motor, and who is, yes, sphenopalatine. Coffee and Scrubs has given a correct answer, sphenopalatine, my dear friends. Now, the pure sensory, pure motor, and mixed. My dear friends, pure sensory is going to be 1, 2, 8. Pure motor is going to be 3, 3 to the 6, 6 to the 12. What comes after 3 is 4. What comes before 12 is 11. Easy to remember. So, pure sensory, it is going to be the 1, 2, 8. That you have to remember. Pure motor is simple. 3, फिर 6, फिर 12. 3 के बाद आया 4, 12 से पहले आया 11. Done. Mixed nerve कौन है? Mixed nerve is again too simple to remember. 5 plus 2, 7, 7 plus 2, 9, and after 9, you have to remember the 12, my dear friends. So 5, 7, 9, 12 is a mixed motor, mixed cranial nerve. Pure motor is 3, 6, and 12. 3, after 3, 4 is coming. Before 12, 11 is coming. So there will be 3, 4, 6, 11, 12. What is left? Pure sensory, that is 1, 2, and 8. 1, 2, and 8. Which is the thickest and the largest cranial nerve? Trigeminal. Thinnest cranial nerve? Trochlear. Cranial nerve with the longest intracranial, again trochlear. सबसे पतली भी trochlear, पतली ज़्यादा अंदर तक जाती है, that is why longest course. Longest course extracranial, that is vagus राजा है. Interosseous मुंह के अंदर facial nerve ज़्यादा है सर. Neuroanatomy part, Broca's area, speech area, which we have talked yesterday. Okay, auditory area is 41, 42. Okay, then visual area 17, 18, 19. Then Wernicke's area, important area where the grammatical errors are corrected, my dear friends. If there is an injury to the speech area, Broca's area. So remember, if Broca's area is gone, there will be aphonia. Person will not be able to speak. But if Broca's is working fine and Wernicke's is not, the person will be able to speak, but the speech will not be clear, my dear friends. Now cavities in the brain, we are having ventricle, which is empty cavity. Who are making them? So lateral ventricle is by cerebral hemisphere. Third ventricle is between diencephalons. Fourth is between pon and cerebellum. Equally important, my dear friend. 𝗖𝗏 and 𝗖𝗏. 𝗖𝗏 and 𝗖𝗏 are branches of. 𝗖𝗏 is a branch of basilar artery. 𝗖𝗏, which is posterior inferior cerebral artery, which is a branch of vertebral. Now they are equally important to know. They are formed as circle of Willis also. So remember, anterior cerebral, posterior cerebral, anterior communicating and posterior communicating. So these are the arteries which are combinedly forming the circle of Willis, my dear friends. Now these are some areas, if you have to remember, where cerebellum is present, where pons are present, where the structures are present, and on this image basis, sagittal section, you check where your third ventricle is, where your fourth ventricle is. Now coming to the parts of basal ganglion. And this, you just go through the names. What are the parts of basal ganglia? Can you tell me what is the function of basal ganglia? Planning and programming is a function of the basal ganglia, my dear friends. Planning and programming is a function of the basal ganglia. Pars, GCS, putamen, amygdala, substantia nigra, subthalamus, globus pallidus, caudate, and claustrum. They are the part of basal ganglia. Deep cerebral nuclei like dentate, emboli, fastigian, and globus. They are the part of the deep cortical nuclei. Now, sir, abdomen and pelvis. Now, remember, abdominal aorta is giving branch to common iliac artery. They are giving external iliac and internal iliac artery. What are the ventral, lateral, and the posterior branches and the terminal branches? The four things we have to divide in the abdomen, and we have to study that. So, my dear friends, in the ventral branching, the celiac trunk is supplying to the foregut. midgut, and the defecating part, all those lower structures are hindgut. So celiac trunk is supplying to foregut, superior mesenteric artery is supplying to the midgut, inferior mesenteric artery is supplying to the hindgut. Foregut, midgut, hindgut, my dear friends. Now coming to the lateral is गर्मी. लेट के गर्मी लगती है, गर्मी G for gonadal artery, renal artery, mid suprarenal artery and inferior phrenic artery. Very simple to remember. Please revise along with me. What are the lateral branches? Your answer is garmi, G for gonadal artery, renal artery, mid suprarenal artery and inferior phrenic artery. Now let's talk about these posterior branches. Sir, these are the 4 pair of the lumbar artery and 1 median sacral artery, terminal में right and left common iliac artery. How? The one-liners you have to remember. Portal vein कहाँ से form होती है? This portal vein is formed by splenic vein and superior mesenteric vein at level L1. L1 पे portal vein is formed. Splenic and superior mesenteric vein. Policeman abdomen, greater omentum. Bed of stomach, never formed by spleen. Large intestine, longest part is transverse colon. Most common position of appendix, again a previous year question, PYQ. It is retrocecal, least common is post-ileal. Now coming to the duodenum. Yes, duodenum mein what important thing is present? Brunner's gland. What is the importance of the Brunner's gland? Brunner's gland acts as a buffer secreting structure where it will be secreting the bicarbonates. When the acid is coming from the abdomen, it will be highly acidic. It can burn the intestines, so neutralize it. There is a Brunner's gland present and this Brunner gland is producing the bicarbonates. Callout's triangle. Content is cystic artery. Again, an important question from the surgery. Inferior surface of the liver, common hepatic duct and cystic duct and gallbladder. ICC you have to remember for the content triangle. Callout's triangle. Now remember true support of the pelvis. This is question and this is your round ligament. Again asked in the exam, both covering from your gynae and the anatomy part. Testis descent is very important. Where the testes were, how they have covered the journey and where they have reached, we all know. So 4 to 6 months they were in the deep inguinal ring, then they came in the canal in the 7th month, then they come in the superficial inguinal ring, and in the last 9th month they came to the scrotum. If they are obstructed in this normal path, this is called as undistended testes, and if they are present somewhere else, maybe they are present on the shoulder, head, eyes, mouth, then this is called as ectopic testes, my dear friends.